afternoon, everyone. Welcome to Gallup Nigeria. Today we are commemorating Female Genital Mutilation Day 2021. I'm going to be giving the opening remark in a bit. We'll start in like 3 minutes. Thank you. Good afternoon, everyone. My name is Balki Salaudin. I'm the president for Gallup Nigeria. I'm so happy to have everyone here. Gallup Nigeria started out last year after the Gallup Leadership Summit, which was held virtually, and I decided to localize it, and that was why I started Gallup Nigeria, to support young girls, women, to realize their real potential starting from their community. And we associate ourselves with the United Nations celebrations, which female genital mutilation is one of them. And that is why we deem it fit to commemorate this day with every one of you. I want to especially appreciate Our Excellency, Barrister Farid Sarki, for giving us that room to call her anytime we want. And she's going to be joining us as a keynote speaker this afternoon. I want to also appreciate architect Lola, who is also an FGM survivor, and she has been doing so well in the advocacy, to end FGM in Nigeria. So these are people that we reckon with. We appreciate what they do in the general public through their foundation. We're going to be having a panel discussion also, where we discuss things how we can all collectively, end FGM in Nigeria. So also, before I wrap it up, I want to appreciate our partners. First of UNFPA for giving us free t-shirts to share with most active participants. We have 20 of the shirt, and I want to appreciate Youth of Africa for making this shirt available to us. I would also like to appreciate Wave Foundation for their support, and every one of you who have been supporting Girl Up Nigeria since we started. So I'll give the floor to Her Excellency, Barrister Toyin Saraki. She's the founder and president of Wave Foundation Africa. Yes, so guys, I want you to sit back, listen to this woman speak. This is my first time of engaging with her. And I'm so excited. I'm sure everybody is excited. So guys, let's do this. Yeah, over to you, Ma.
I'm unmuted.
All right.
Lovely. Thank you very much for inviting me, and a big thank you to Girl Up. I'm delighted to join this distinguished collective of advocates and change makers as we come together of delivering a permanent end to FGM practices nationwide. Indeed, there is no better time to say we have no time for global inaction, and we must unite, fund, and act to end female genital mutilation. I'll take you a little bit back in history. When I founded the Wellbeing Foundation Africa in 2004, we were a community reflective organization, very small at that time, setting out to ease and equalize access to maternal health care for women and families who were on their reproductive journey, and for those who would one day begin that reproductive journey. Our voice was pointed in the direction of increasing diligence, ensuring regular access to antenatal and postnatal care facilitated by our community-based midwives till today. And in doing so, we've been able to champion the promise of a true continuum of care being afforded to all and reaching those even in the most remote locations from birth to age. As the earth's determination and responsibility to disseminate and empower households and communications and communities across the nation increased, our adolescent skills and drills, personal, social, and health education programs welcomed an educational approach that promoted equity by way of knowledge bearing, encouraging the weighting of upskilling to be equal amongst young boys and their female counterparts. And while we celebrated the great and plethorous strides that we were making in the hearts and homes of the many Nigerians that we served at the front line, FGM cases continued to rise. Between 2004 and 2015, more than 19.9 million Nigerian women and girls had undergone FGM, making us the third largest contributor to the overall global FGM burden, just behind Egypt and Ethiopia, where the numbers are estimated at 27.2 million and 23.8 million, respectively. So that tells us that if we've got 19.9 million Nigerian women and girls who have undergone FGM, we must all know at least one, if not more. Now, I believe that teaching, leading, and being taught run together, and in tandem to achieve measurable results. I recall the time I spent in Kenya learning from AMREF on the remarkable work that they do on their Yes, I Do alternative rite of passage, training and graduation initiative and ceremonies. This is an initiative which seeks to reculturalize sub-Saharan African girls in understanding the art and science of personal and community-centered progress by working directly with decision makers in their families and their communities, and therefore avoiding the girls being made subject to and victims of FGM. We cannot combat and stop the act of violence that is FGM without understanding the harmful cultural traditions that put our women and girls at risk. FGM in many communities is sadly perceived as an investment in a girl's future chastity and therefore the moral conduct of the female gender in that community. Thus, the cutting and even the total excision of a girl or woman's intimate body parts leads actually to a lifelong search for sensation, the opposite indeed of the intention of that harmful cultural tradition, an act of violence which we are all working to curb and stop. FGM is peculiar in that it is an act of violence often effected upon its victims, the female gender, by other members of the female gender, in the misplaced and harmful aim of ensuring community approval, and it's often misendorsed by the male gender, who should bear the traditional responsibilities of shelter and protection. Thus, as a catalyzing behavioral change program, the alternative rite of passage approach is intentional, invested, and a results-based catalyst that strengthens holistic contributions on the journey to ending this human rights violation. Sorry, I'm just closing my survey that's come up. Human rights violations, and it also places both bodily autonomy and future prospects back in the hands of the girl child, championed by her traditional protectors, her male and female relatives, her community, and her faith leaders. Now, in order to actualize our goals of ending preventable maternal deaths and creating safe spaces to counsel communities in reducing harmful cultural practices by increasing the availability of family planning education through our 55 qualified midwives, the Wellbeing Foundation Africa continues routinely to deliver our frontline MamiCare 360 antenatal and postnatal maternity programs across Abuja, Lagos, Osun, Kaduna, the FCT, and Kwara states. Our midwives have always tackled taboo topics and many of the key conversations that seek to empower and save the girl child of today and the woman of tomorrow. The high prevalence of harmful practices across our nation does not intimidate our midwives as our community angels. They're regularly exposed to all 4 types of FGM, from the cut right through to the total removal of the clitoris, and they have been empowered to advocate because they have been equipped with the tools and education to identify accordingly. In many a community, it is only at childbirth that you will discover that that is a family, a mother from a family that practices FGM. And so it is from childbirth, upon that detection, that our midwives get the trigger to work on the entire family to make sure actually that the newborn girl is not equally made a victim. Because quite peculiar to Nigeria, we practice FGM in Nigeria between the ages of birth and 4 years. So if this intervention is not actively sought out and implemented, it's too late by the time you find the next victim. This community-centered approach to facilitating care has also afforded educators and healthcare givers the opportunity to forge authentic relationships built on trust and consistency in some of Nigeria's most culturally ingrained and deeply traditional cities and villages. In doing so, those who have overcome the trauma of FGM pay the emancipation forward. It is in each of these instances that the health and well-being rewards, and in turn, the health and well-being risks that run within each household become more apparent, and a truly adversarial approach is adopted by the women who facilitate care and each woman and child that said care is given to. The midwives and community health workers who aspire to follow in their footsteps are majorly women and have proven effective in improving women's health, including sexual and reproductive health education and reducing child morbidity and mortality. They begin conversations at the crucial point of approaching their reproductive age. Women who have come through our programs understand their own healthcare needs best and are therefore they are best placed to encourage and deliver that family planning and offer counseling on pregnancy-related issues. Female community health workers are also instrumental in reaching the underserved and most marginalized vulnerable members of the community, especially in weak healthcare systems. It goes without saying that our push for Nigeria to take in order to take the women in the cultures, contexts, and communities where they would have needed permission to see a male healthcare worker, they do not need that permission to see a female healthcare worker. So such authentic relationships and strategies give us greater room and opportunities for the early detection of harmful cultural practices and make space for the intervention, particularly as a recurrence of FGM among subsequent siblings remains high. The role of the midwife or community health worker thereby lends an opportunity to radically interrupt. By serving as a safe space for education and also for protection, we're making brave spaces for harmful practices to be reported and to be stopped. When we think towards zeroing our collective tolerance for FGM practices, female healthcare workers are an indefatigable asset to society. Placing midwives at the center of our work gives us an army of intentional community counselors, wardens, and saviors, all while helping to drive the behavioral change to make women an empowered and informed agent in their own life and in their own health. Our midwives are our interlocutors between our foundation and our goals and the women and children that each program sets out to serve. They should, however, if they are working effectively, also become the interlocutors between every government and global institution and the community. To achieve this, we must enable and elevate midwives with whole system support as defenders of women's rights, involving them in the development, dissemination of campaigns and strategies for identifying and supporting those most at risk. It is our female community health workers who remain instrumental in reaching the underserved and the most vulnerable members of the community, especially in weak healthcare systems. The safe spaces and safe conversations that they give, where no subject is taboo or off limit, goes without saying that investing in the female healthcare worker is the vital evidence. Receiving trusted the midwives and community health workers who aspire to follow in the footsteps of these female health workers will majorly be women and have proven to be effective in improving maternal and child health. We improve the promotion of breastfeeding and immunization, essential newborn care, sexual and reproductive health education, reducing child morbidity and mortality. And the women understand their own healthcare needs better, and they are best suited to encourage and deliver antenatal and postnatal care, family planning, and offer counseling on gynecology-related issues affordably. What can be done for those who presently reside on the front line? We must retain, remunerate, support, and upskill healthcare workers accordingly, celebrating their efforts daily and map out a powerful leadership path to incentivize them. Healthcare in Nigeria must be made a good and attractive career choice, and each and every position occupied should be by those who understand and are committed to success in communicating and caring in a truly cultural, sensitive, and human way. We acknowledge today that globally, FGM is a harmful cultural tradition that is being challenged by legislation and localized strategy approaches to break. What must happen is that as each nation begins to question, prepare for, and educate its citizens, in doing so, we will be able to stunt the perpetual narrative and attitude which displaces those practices as being a universal fight and a collective journey towards the end, zero FGM. If FGM is the villain, we are more than equipped as global and local citizens to assume the collective responsibility of heroes, or should I say heroines. The issue of FGM requires a holistic understanding of the negative implications and the drivers of these deeply cultural embedded practices. We also need an orientation of the problem as one that is not just localized and isolated, but as a problem that truly affects national societies and our global shared community identity. One city, the state of the woman in one village or in one city affects every child and every woman and every man across the world. Some nearing 20 years later, and as my advocacy continues to take the form of amplifying the voice of every girl seeking to enjoy her childhood, having access to a fitting education, being living proof of beyond optimal levels of health, and having complete autonomy and choice over her own body, I know today, and I'm sure you all know too, that the girl child should evolve into a woman with the choice and potential to bring her own child into the world safely at a time of her own choosing, and to nurture the children from birth to age. I'd like to use the words of Tian Wei, the news anchor for CCTV News in China, who says, any society that fails to harness the energy and creativity of its women is at a huge disadvantage in the modern world. Now, this is very true for the healthcare sector in Nigeria, where we have glaring disparities between women's and men's access to healthcare. This gender inequality in Nigeria's healthcare system is a hindrance towards realizing and actualizing universal health coverage. In order for us to see the manifestation of effective health outcomes and the realization of the Sustainable Development Goals, it is important that Nigerian women and girls access quality and affordable healthcare. Women and girls face the threat of harmful practices and gender-based violence, and we have specific health needs, but our health systems continue to fail us. Primary health care, to me, represents a constantly renewed and reviewed positive social contract and a bond between a government and its people. It remains one of the most strategic investments in the health and well-being of women. Trust lies at the heart of the success of this system, and the system is predicated on unity. We need more information and support regarding the effects that FGM has on girls and women, both short-term and long-term, at the primary healthcare level, from trusted sources and actively disseminated in a way that will truly reach and resonate with our people. The educators of the Wellbeing Foundation Africa and our Mama Care midwives constantly have these safe and cultural sensitive conversations. Their weekly classes take place in primary healthcare centers, hospitals, and at camps for internally displaced persons, a frontline for women and their infants. Now, despite our dire mortality rates here in Nigeria, where women face around a 1 in 13 risk of maternal mortality today in their lifetime, we have not lost even one of our over 250,000 Mama Care mothers annually during childbirth. We believe this to be an amalgamation of our morale, dedication, and our commitment to the ICPD 25 3 zeros: zero unmet need for contraception, zero preventable maternal deaths, and zero gender-based violence and harmful practices, including child marriage and female mutilation, as well as the teaching and facilitation of emergency obstetric practices for women who have been subject to FGM. Across the globe, there have been many successful and pivotal efforts to drive both change and awareness in the FGM arena, further reiterating to us that a collective clarion call is both effective and necessary. We will, in effect, be each other's measurement indicators. In the global north in particular, we've seen the success of intentionally erected specialist nursing, midwifery, and education teams who assume a truly concerted effort to actualize early detection. As FGM practices continue across Nigeria, we also need an intentional, multidisciplinary approach fashioned for the early detection of risk to FGM and strategies to dismantle the cultural saturation that must be introduced during the preconceptive period. Both adolescents and women of reproductive age, coupled with the cultural sensitive dissemination of such, are and still the key determinants in putting a solid end to these harmful traditional practices. According to the World Health Organization, women account for 70% of the global health workforce. However, the female health workers are concentrated in low status, low paying, and unpaid roles while facing themselves a constant threat of gender bias and harassment. The barriers that female health workers face undermine our efforts to realize gender equality. It's paramount, thus, that the contribution of female health workers in the healthcare system must be recognized and well remunerated. The need for availing equal opportunities for training, advancement of women within the health workforce, and representation of female health workers in senior leadership positions is ongoing. We need to be intentional about addressing gender bias, discrimination, and inequities in the health workforce to power a female health workforce that can stop FGM. When the quality of life for women and girls are represented at the highest decision-making level, women and families will feel empowered and able to make decisions regarding the quality of life, and more lives will be saved. When female health workers are represented in senior leadership positions, there's a high chance for gender-inclusive health decisions and policies that put women's needs into consideration to be formulated and implemented. This will then ensure that women access quality healthcare for issues that are as a result of FGM and other forms of physical harm. Women choose to become mothers, and mothers choose to become nurturers and caregivers. We must be alive and able to make these choices, and we must be able to advocate for our own girl children in order to avoid her falling to FGM too. Investments in women, adolescents, and infants always bring the best returns, and an early detection or intervention of FGM will certainly promise to do the same. Women are key to achieve the demographic dividend that comes with the interplay of reduced total fertility rate, an expanded base of working age population, and improved educational, infrastructural, and healthcare investments. The United Nations estimates that gender inequality costs sub-Saharan Africa an average of $95 billion a year. Our countries do have a moral and economic imperative to transform the equality agenda. Now, I would like to begin to close and conclude by taking us back to our native Nigeria. At home, 77% of our FGM cases are performed on young girls between the ages of 0 to 4 years, and a worrying 87% of cases are performed on those aged 0 to 14. These are performed by a traditional practitioner within their community. So, the prioritization of global impact in alignment with the United Nations Sustainable Goals has to inform our objectives towards measurable and meaningful outcomes. We are told commonly that it takes a village to raise a child, and in the instance of FGM, it is commonly that very village that the child is born into that emphasizes the harmful practice of FGM. I'd like to charge us all today with redefining this village. We must reposition the task of rearing, interceding for, and eventually protecting all the young girls and women that we know from FGM by each of us here today. In our mission to improve health outcomes for women, adolescent girls, infants, and children, the Wellbeing Foundation puts gender equality and the empowerment of the woman and the girl child front and center as we combine and integrate our programs with advocacy work locally and on the global stage, because we believe that to overcome harmful practices, maternal mortality, poverty, inequality, and social injustice, equal rights and opportunities must be the social determinant that is available to all people, irrespective of their tribe and culture. I look forward to listening to you today, to learning from you today, and to working with you as we go forwards.
Thank you so much, Your Excellency, for that insightful presentation. I have personally learned a lot in terms of statistics, and I'm very sure that everyone here have picked one or two things. And I'm sure we all have questions for Her Excellency. But before we take questions for her, I would like to call on Truth to introduce the guest speaker. Thank you so much, Your Excellency.
Thank you.
Thank you, Your Excellency. Thank you, everyone, for joining. Our next guest is architect Lola Ibrahim, but she's ably represented by the Director outreach and community engagement at Women Against Violence and Exploitation Foundation. That's WAVE Foundation. His name is Chinanzo Mbanu, and he's an MSc student in environmental management at Teesside University, United Kingdom. He's also a very strong advocate of the SDG 5 and very passionate about ending gender-based violence around the world, especially in Africa. He has 8 years background in research and analysis using SPSS. Without further ado, I'd like to call him on stage to present.
Okay, good evening, everyone. Yeah, good evening, everyone. Can you hear me?
Chinazu, we can hear you.
Okay, can you hear me now?
Can you be a little bit audible?
Okay, can you hear me now?
Yes, better.
Okay. Please, I would like to share my my screen. I don't know if I can share it from my end. I would like to share my screen.
Yes, you can go ahead, please.
Yeah, I can share it from my end. It's disabled.
Share it from my hand.
Okay, just share it for me, please. Thank you. Okay, before we start, my name is Chinazo, and I would like to acknowledge the keynote speaker for actually doing so well about FGM and gender-based violence in the world globally, especially in Africa and Nigeria. So, according to UNFPA, 2 million cases of FGM, there will be like 2 million cases of FGM cases by 2030. And this actually caused by actually this pandemic. And this would have been averted if not because of the pandemic. And then in 2021 alone, we have 4.16 million at risk of this FGM, women and girls at risk of this FGM. And we have 1 in 4 girls and women of 52 million globally that have experienced this FGM. So this is actually a worrisome issue. And this year, tagged the International Day of Zero Tolerance of FGM, calls for action and a lot of collaboration and awareness. So then, looking at my slide, although I can't see it very well from your side. I'm actually looking on the dangers of female genital mutilation to health and well-being of girls in Africa. And when we look at what WHO said female genital mutilation is, it actually comprises of all procedures that involve partial or total removal of external female genitalia or other injuries to the female genital organs for non-medical reasons. So this actually is a practice whereby the genitalia of the female is removed or maybe is cut. And this practice is actually mostly carried out by some traditionalists or some people that are called some traditional circumstances, and sometimes health workers. Although WHO has strongly urged the healthcare workers not to involve in performing such acts, because most times they say that it's more medicalized because it's actually a health worker, but it's actually very wrong. So now, according to the NHS UK, we have 4 types of FGM. And the first type is actually removing part of or all the clitoris. Why the second type? By when I'm talking about this type, but it's actually now we can now or somebody that undergoes the removal of parts of all the clitoris and then the inner labia, that is the lips that surround the vagina, with or without removal of the labia majora. So this actually may be they might not remove the larger outer lips, or sometimes they will remove the. So the third one is actually what is actually the narrowing of the vagina opening by creating a seal formed by cutting and then repositioning the labia. So this one is like after that they will seal it up and have there will be a small opening where there will be the female can now use in urinating. Maybe the time that the woman, the girl or the woman, the lady want to get married, and the person need to actually, the husband is the one to losing that, and this have a lot of implications on females. Then other harmful procedures, like that is actually the third one, other like maybe cutting or pricking or piercing or scrapping or burning the area. So anything that happens around the female or the vagina or the clitoris or around the female private part is actually what we call FGM, whether it's cutting, scrapping, or any type. So it's actually classified into 4. So looking at the next slide, we see the pictures showing the types of FGM. The first type here, you can see that there is a removal of the clitoris, and then there is actually a touch at the labia. And the other second one, you see there is actually a total removal of both the labia and then the last one, there is actually the covering and then an opening where the female can use for urination, maybe to urinate or to for menstrual period or time of removing of the. So all these things have a very strong health impact. And looking at the health impact of this, looking at where this FGM is practiced, that is the next one, is actually practiced in 31 countries in Africa. And Africa is one of the highest places where this FGM is practiced, looking at the world map globally. And where Mali is actually the 90%. And looking at Egypt, Guinea, Djibouti, and Mali, then Nigeria is also part of the countries that is practicing FGM in the world and other parts of the countries. And most times, if you go to like United Kingdom, US, most people that practice it actually come from this part of the world because they are in their homes, so they can actually practice it. How does FGM affect the health of the well-being of a woman? So looking at the effects, since this involves cutting, this is actually an opening, most times sealing of the vagina, the clitoris or the female organ. So this actually can affect the woman a lot. Maybe it can be long term, it can be short term, but there is a very serious impact on this. Both long and short term is actually a serious one. Looking at the short term impact, we have immediate complications such as severe pain, shock, and then there is actually bleeding. There is tetanus can cause, because most times they use equipment or instruments that are not sterilized or that are not good or hygienic. So there might be a tetanus, there might be an infection, there might be a urine retention, there might be an ulcer. Anything can happen to that region, and this can cause a lot of things. It can also cause death most times. It's actually one of the causes of death. Maybe when there is a severe bleeding and also infection, this can cause, is enough to cause death. Then when we look at the long-term effects, this one has to do with when the person is grown up. Maybe the person actually survived at the younger age, and after the time of that, because it normally occurs between 14 years and then 15 to 49. So if the person survived, this happened to, there is something, this issue of giving birth is a very serious one. Then painful sexual intercourse. The person cannot be able to enjoy the intimacy with the husband. This is a serious issue. Then there is also a sexual dysfunction. There is what we call psychological effect. That is actually where the impact is actually highly felt. The mental health of the person is threatened. And all this is a lot of complication. And the third type of FGM, the type 3 FGM, causes what we call vaginal obstruction. Sometimes the vagina will be accumulating a lot of menstrual flow in the vagina and the uterus. And this can actually create a lot of problems, complications. Sexual intercourse will also be about, like, will not be, that will be very serious. The person will have pain during sexual intercourse. Then childbirth will also be a problem because they have altered the natural or the way the part or the female organs should be. So this actually causes a lot of impact on health of a female. So after looking at all this impact on all these effects of FGM, so what is the way forward? What should we do? This is one of the reasons why this year International Day of Zero Tolerance of FGM, titled "No Time for Global Inaction, Unite Fund Act to End Female Genital Mutilation." Then this is actually called for collaboration. There should be solidarity. There should be collaboration of NGOs. There should be partnership. Everybody is coming together to fund, to make sure they act at every point, wherever you are, you act. You sign letters, you send a political leader, you pass a lot of laws, make decisions that is favoring, that's making sure that this FGM is stopped anywhere in the world, or especially in your niche, where you are living. That is very important, where you are, where you start from your home, start from your community, start from your state, start from your country, and then move up. That is actually the more important of this theme of this year. No time to just sitting down waiting. So everybody should stand up, unite, collaborate together, fund, act now to end this. Then there's a very serious issue. Like, we need to create awareness and encourage actions to address female genital mutilation. When we say create awareness, just talking about female genital mutilation on social media is not enough. And then we should also encourage actions like making sure we pass bills if we are in position, making sure that we make decisions, we reach to people that are capable of taking actions on this issue of female genital mutilation. Starting from your community. When we say your community, we have what we call counselors in communities. We have the traditional leaders. We have the chairman of the local government. Starting from your community, move upwards. That is where it starts. You can't just fly to the air to go and start. If you want to create a change in your home, and then you move out of your home. Then this is actually going to cause a lot of effect. It will also help us to zero this. And we have to actually know that COVID-19 has not have actually excavated this, have actually increased this harmful practice, because most times we are supposed to do some of the time we are supposed to be out, like the time during the lockdown, most people are inside their houses, and this actually encourages this act so much, because nobody is looking out for anyone. Everybody is in their homes, and this is where this FGM is practiced. So knowing that this COVID-19 has also increased this FGM, so we need a lot of action at this point to make sure that all the girls are safe, and all the women in Africa, in Nigeria especially, and then in your community. When we are talking, you are just making emphasis on where you are living, because your needs, your ecological need is very important. That is where change can begin before you can move upward. And
thank you so much.
Thank you so much for listening. Thank you so much.
Thank you so much. Thank you so much for that wonderful presentation. I went through the slide yesterday, and I was wowed by the detailed research that you guys have carried out at WIN Foundation to present today. Thank you so much. We appreciate it. I'll call on Ola Yemi Samuel, who is going to coordinate questions and answer. So please, if you have any question for our keynote speaker, Our Excellency, or you have for our guest speaker, kindly raise your hand. Samuel is going to coordinate that. Thank you.
Good afternoon, everyone. I'm glad to be here this afternoon. First of all, I would also like to appreciate Her Excellency Toyin Saraki, the President, Wellbeing Foundation Africa, for a detailed keynote address. We sincerely appreciate you, ma'am. That has really provided an overview on what we need to know about female genital mutilation. And also to the representative of architect Lola Ibrahim. I think that was a good presentation. He actually took us through dangers of FGM, the role of health workers and traditional birth attendants, and also giving us a number of statistics on where FGM are being practiced.
Okay, I think we lost Samuel. He's having network challenge. Okay, so I guess I'll just undo that while we get Samuel.
So right away, like Baliki said,
Samuel,
if
your
you
network
have
is breaking.
a question.
Samuel?
Hello?
Yeah, your network is breaking. Do you want to like go out of the meeting and log in back?
Hello? Yeah, so I think back now. Okay, hello. So
Samuel?
Okay.
Yes, please log in and coming back. Thank you. All right, so if you have any question, please raise your hand so that you can be unmuted. We're doing this in 5 minutes so that we can go to our panel discussion. If you have any question, so I guess I would go first. So my question is to Her Excellency. So Ma, since you started a Wellbeing Foundation, and can you really say that there is that change that we can visibly say, okay, this change is visible in local communities where this action is happening? Can you really say that there's change, even if it's little?
You know, what I will say is that there's increased awareness. When we started working in 2004, FGM was not even something that people reported. You know, the communities and families, actually, I think I need to take it even to the smaller level. The families that were practicing FGM, it was normal to them, and they even saw it as good. And so the real work lay in actually sensitizing without stigmatizing. And between 2004 to 2011, as of the time that I actually stopped being a first lady, I initially felt very relaxed. And I said, yes, you know, everybody in Kwara State has heard that FGM is not good. And I always made myself very approachable, actually. So anybody who wanted to report FGM, because there wasn't a government reporting mechanism. And actually, there still is no government reporting mechanism in Nigeria. So people would feel that they could report to me and I can go and visit the family and I can talk to them. And then, you know, my midwife started to take over that role. But I have to be honest, we can't pat ourselves on the back, because I think it was in 2015 or 2016 that I suddenly came across some news long after I left the state as a first lady, even though I still have programs there that work every day. I came across some news that I don't want to call him a gentleman, so let me just say some chap, you know, somewhere in Ilorin was charging, I think maybe 8,000 naira to do FGM. And as a result, he had become the most popular practitioner in the state doing FGM. And this was a state where I had almost succeeded in wiping out FGM. So I was so upset that I called the then First Lady and I said, look, what are you people doing? How can, not only is FGM continuing, because of the way this chap was advertising himself, he was owning, as they say in today's parlance, owning his FGM activities with his chest. And I was like, this has actually, gone from a state that was fully saturated with sensitization to a state where somebody could just wake up in 2015 or 2016 and put an advert in the market and say, I'm the one doing FGM, and people were coming openly to bring their daughters. And that impressed upon me that we have to make our ending FGM strategies a routine and daily activity, not just something that we do on an instrumental outreach, not even something that we do weekly. So we actually then started writing in the detection of FGM into our personal health records as a trigger, both to the receiver of the record and to the midwife or health worker that is the interlocutor, a daily reminder that FGM has to be stopped. FGM is not good. And I am really looking forward, actually, to being able to push through a program that gives people an alternative rite of passage. So my own is that every family that where we think a girl is at risk of FGM, rather than the amount of money that you're using to pay the FGM practitioner, open a savings account for that girl with the money. Then take the time to talk to, we don't talk enough, within our families. Let's actually have the conversation, which is a 2-way or 10-way conversation about if chastity is the aim, chastity before marriage, let us have those open conversations, not threats. On the importance of keeping chastity before marriage, on the importance of being an adult and being able to make your own decisions. The other day, and I won't say it laughingly, but I'm looking at the proliferation of Kayan Mata sellers, across Nigeria and how well they're doing. And I'm making this, correlation to that to women who have had FGM. What is fueling the market for women to find sensation and supposedly be most attractive partner must have some relation to the fact that FGM has been performed. And I will not say the women, I would say our women, because we're all each other's sisters. So we do really need to be each other's keepers. And I want to disabuse the notion that FGM only takes place in northern Nigeria. FGM takes place across Nigeria, whether it is Ebonyi State or Imo State. This is a harmful cultural practice that is within the Nigerian lexicon. It's not within a particular religion. It is within our cultural tradition, and we need to shine light on it in order for it to stop. I remember the first time I saw those charts of the 4 different types of FGM, I felt sick to my stomach. And actually, you might not know that the chart being used by the NHS, which Chinazol has just taken us through, was actually designed by a Nigerian woman, a Nigerian nurse midwife, Comfort Momo, who has worked very, very hard on FGM. And I think we need to have posters that, those charts are charts of intimate parts of a woman. But, most of the greatest evils are done in darkness. Perhaps if we shine a light on it and have the posters, because they're not photographed, they're graphics. Perhaps in every village, in every town, in every primary healthcare center, one of those posters of the 4 types of FGM need to be, put where people can see them. It's not as simple as having your ears pierced, if you understand what I'm saying. It's an act of violence that is probably done well-meaningly, but creates lifelong damage. And I think we do need to shine the light up. I'm just excited at the amount of young women on this call. I'm looking at all your faces very carefully and thinking, yes, the youth have stood up to seize that knife. You understand? After seizing the knife that is used to cut, we also need to seize the leaves and whatever it is that, are placed on the girl to be able to actually stop this practice. In some countries, in countries like Sierra Leone, it's actually a practice that young women elect to undergo themselves. Now, if young women are electing to undergo it themselves, that's an informed and educated decision from them, and I hope they will change their mind. But FGM is not something that should be done on a non-consenting human being. And a baby or girl of 14, that's not a consenting, consensual, respectful relationship, and we must stop it.
Thanks so much, Your Excellency, for that insightful response. So I'll quickly ask this question before I will move Kende to ask a question. There was this case I was handling in a lorry before I traveled down to Lagos about a 14, 15-year-old girl. She was pregnant. I'm not sure if they've aborted it or they are still keeping the baby for her. She acclaimed that she was raped, and her mother too said she was raped. But when we got to the police station, we did the whole questioning, we brought the guy, and we realized that this girl actually had sex. Like she was one that wanted to have sex, with this guy, and she just finished her junior WAEC. So do you think traditional guys would listen to us, when they have these issues happening to their children at a very young age? How do you think we can control it to the local level where these girls too they understand what they're doing? I was shocked that a young girl would actually call for sex. She really, and if you see a very small girl, beautiful, we're already like, oh, we're gonna make sure that this guy rots in jail and all of these things. But finding out that no, they actually had sex we were amazed.
Well, first of all, let me say that where I come from, and according to the country's law, sex with a minor is statutory rape, irrespective of whether that minor, the minor as a young child who has not attained the age of majority,
Yes.
cannot be asked to bear the responsibility
Yes.
for what we call premature sexualization of behavior. Now, for me, and I particularly always, that's part of the reason why I continue my programs in Kwara State. Kwara State is at a confluence in Nigeria where you have all the religions and all the faiths meeting. So actually, from a development perspective, if you work in Kwara State, you are exposed to every context. Now, if I take 2003, when I became a first lady in Kwara State, and I don't want to keep looking back, but our rate of child marriage and child sexual activity, how we calculated it at that time was by calculating what our recommendation would be for the administration of the HPV vaccine. You understand? And I was horrified at that time to see that my global experts were recommending that we administer the HPV vaccine, which was very new then, at the age of 9. So I knew that we had a major problem. Like, for instance, the recommendation for HPV vaccine in inner city London is also between age 9 and 10. So, whether we want to have those open conversations or not, when you look at what age you should administer HPV, it tells you the age of early sexual initiation of that particular area or community. Now, how I worked on that was by working on the Child Rights, domestication of the Child Rights Act, to retain a girl child in education at least until the end of secondary. Like I say, we can never apply a solution to one community and think our work is done. You're just telling me now that a couple of years ago, I left Kwara State personally in 2011. A couple of years ago, you were working in Kwara State. A girl who just done WAEC, was showing a desire for sex, which is a premature desire for sex because she is not an adult. That tells us that we need to go back and we need to reinforce social protections. You have that case in Kwara. You have the case of Ochanya, which was, I think, in Benue, where her mother died. Her father was her guardian. Before you knew what, she was the preferred sexual partner, not from her own choice. It couldn't be from her choice anyway because she's a minor, so she doesn't have the age to make a choice of the entire household until she was pregnant. She was raped nonstop. She got pregnant and eventually died having a child. Now, if the first thing we're going to see as a symbolic of that we have a problem in community is a child giving birth to a child. That tells us that we need to go back right to the very beginning of our work, and we need to reinforce every aspect of that work. And we need to do so without blaming the girl victim. And then now I will tell you that we're not talking about only girl victims. What we now know of our indices in Nigeria is that boys can also be victims. Boys may not be able to get pregnant, so we don't see the physical manifestation of their victimhood so obviously, but we do need to take an approach that is holistic to protect minors, to educate minors, so that even if it is being visited upon them, they recognize it as wrong. And that is where the respectful relationships education in our secondary schools, through personal, social, and health education, comes in. That young girl who supposedly desired sex, the boyfriend, they called it rape. They discovered supposedly it wasn't rape because she had the desire for sex. She's just another young girl who needs protection, and she needs to have that education and information to actually know that that particular urge she might have felt or might have been groomed or coerced was actually a predatory urge, if you understand what I'm saying. She had a predator, and let's not make a victim into a co-predator. She was subject to the actions of a predator, and at least until she's 18 or 21, that is the way it stands in the law. And I hope we will get support from the communities for that approach. Also, we do need prompt SARC services, prompt referrals, and referrals that aren't necessarily taking the victim to the police station, referrals that are taking the victim from the school or from the community to a hospital so that they can report without fear of stigma. I really think that would be a way forward.
Thank you so much. I guess, and I believe that in every state, we all have this issue, but how we're addressing them sustainably is just very different. And I also think that another problem we're having as a country is that we don't have a continuity system where if someone leaves a position, another person comes and continue the process, but we all want to have our own initiative, do it. So I think we need to really improve on that. So I would like to unmute Kende now to ask a question. Kende, you have the floor.
Yeah, thank you very much, Balkis. Thank you, Your Excellency. That was a very insightful piece. I was struck by two major approaches to eliminating female genital mutilation in Nigeria. And the first, probably because I'm a political scientist, so I was really, really fascinated by that approach. And that is having more women in governance, as ensuring more policies that guides the seeks to eliminate it. As we're much aware how marginalized women are in politics globally, and even in Nigeria, where we have less than 7% of women in representation. Do you see, until we get to that space where we can, or that position where we can, proudly say that we attain equality in governance, do you see we eliminating female genital mutilation in Nigeria? So the second question, just very quickly, you mentioned the multidisciplinary approach. Quite a number of persons usually highlight this when recommending way forward to eliminate female genital mutilation, and this means quite a number of things to people. So I would just want to know what you mean by the multidisciplinary approach, what you your position when it comes to that. Thank you.
Well, first of all, I think everybody knows that I'm one for females. The rise of women and girls, and educating, empowering, and giving women and girls the opportunities to lead. I have never believed that for women and girls to lead, they have to wait for somebody to give it to them. I think you can be a leader from your household, you can be a leader in your daily actions, and you have to be empowered to be able, and engendered actually, to be able to seize the opportunities when they are in front of you. I believe that the leadership of women and girls will start from the community level, and we need to build a pipeline of so many women and girls with leadership capacity, that we move our country away from that tokenism approach where they say, okay, we've got 10 positions and we've got to give 3 of them to a woman, and it's one man that is deciding which woman they want to give it to. We need more women so that we can make our own choices. I will ask our fellow women to please, when a woman is in front of you and she's seeking voice sounds, just take that decision based on her qualifications and the energy that she is presenting to serve. Because
Yeah, I think our excellencies have it. Okay.
disciplinary approach, it takes us back to the issue of how we perceive leadership. So, for instance, if you take a regular PhD, that health facility, the doctor, the midwife, the nurse, they all receive the same training so that effective task shifting can occur and we can assure the quality and availability of that care. So when I say multidisciplinary, I really mean multidisciplinary. At every tier of the very interlocutor that you will encounter, we want you to have the same training and feed into the same reporting mechanisms so that you can actually get the help you need. I like to break things down from the scientific language to the basic language. We had an example of multidisciplinary a minute ago when Olayami's microphone failed and Chiamaka could take over that section because she knew what Olayemi was supposed to be delivering. When we empower ourselves with the knowledge, with equity and equally, any of us should be able to be our sister's keeper. And that should be the journey that a woman encounters when she seeks help. When she seeks help for the first time, she's likely to seek it at the lowest point. So we have to make sure that the lowest point is as well trained as the highest point as you or me. And that's what I mean by multidisciplinary approach.
Thank you so much. Kende, I guess Our Excellency has responded to your question very well. So I'd like to unmute Truth to also ask a question. Over to you, Truth.
Thank you very much. Now this question has been in my head for a while, but I just dismissed it as a silly question. But I believe this is a very safe space with Her Excellency. So a while ago, when I was much younger, a friend of mine was talking about female genital mutilation, but at that time I didn't know what it was. She was telling me her mother was apparently her mother was someone who performed this act. So her mom was going to sew together the organ of another woman, and the reason for this was so that it could reduce, it could shorten the days of her period. And at that point, I didn't know whether it was a myth or fact, and until now, I'm not sure if it's a myth or if it's actually one of the benefits of FGM, because I feel like we should approach the situation with evidence and
tie that evidence to day-to-day practice and day-to-day language in what people can understand. Female genital mutilation will not shorten your period. Female genital mutilation will not prevent a young woman or girl from being promiscuous. Let's just knock that on the head. In fact, I actually believe that there's a correlation to show the opposite, that young women who have been subjected to female genital mutilation, sometimes, if given the opportunity, actually embark on the search for sensation, which might predispose them, put them at risk of promiscuity and being preyed on by predators. The truth is what sets us action. There's no way that female genital mutilation scientifically will shorten your period. It might shorten what you see come out of your body because it's finding a way out. And actually, it will begin to produce risk to your health in terms of sepsis. Blood that's trapped that can't come out is just a breeding ground for infection, but it won't shorten your period. And I hope the young lady will educate her parent accordingly.
Yes.
Are-
Ma, are you
are we
done with your response? Okay, Ma, are you done with the response?
Yes, I'm done. Thank
All
you.
right, perfect. So I will unmute Sakina Belou. All right.
Okay, thank you so much, Balkis, and congratulations to the team that put up this wonderful session. And I want to commend each for joining us, ma'am. Thank you so much. I think when you were talking about Kaya Mata, it just came to my head and I was like, wow, she just said it. Because coming back to Northern Nigeria, you get to see young girls. When you see them with some things, you ask them, what is this? They tell you it's Kaya Mata. And a young girl that is just in secondary school, if you go to maybe you talk about drug abuse in school, you talk about some sort of illegal use of drugs in school. And when you begin to talk about these children, they begin to ask you questions, Auntie, one thing they used to mix together, these are things that it actually increase their sexual urge. And for them, they see it like a normal thing. They see it like a supplement of something they can take to maybe boost their immune or sexual immune. But coming back to the effect of when they are aroused and when they come to sexual urge, it's actually a key issue. So Ma, I don't know how to tackle this with the Northern Nigerian context with regards to Kaya Mata, because coming back to the rate of drug abuse is actually high because all of those substances are mixed with sometimes tramadol, sometimes codeine. They use it to mix all of those substances. And before you know it, if you're going to run a test through a young girl that just got married, maybe she's going through some kind of VV issues, you begin to see sample of drugs. And then you begin to wonder, have you been taking drugs? She said, no. What is it that you're taking? Then it goes back to the Kaya Mata. And when they begin to have this urge, and it's something that is overwhelming for them. So Ma, please, how do you think we can approach this? And what mechanism do you think we can put in place, especially for young girls in secondary school? Thank you.
Thank you very much for that very, very interesting question. If I'm to give an answer off the top of my head, because I haven't really given that much thought to the issue of Kaya Mata, beyond the motivation for people to buy these supplements, I would say that Kaya Mata as a supplement should be governed like every other supplement. It should be governed and regulated by NAFDAC. We wouldn't dream of just walking into a store and just buying something that we're going to drink that's making some fantastical promises without looking at the back of it to see the ingredients and what are the effects and what are the contraindications. And if it's some sort of an opioid or a narcotic or something that can have a medical effect on your body, it should be actually regulated by the medical regulators. So I really do think actually that the Kaya Mata practitioners, and there's no doubt that there will always be a market for whether it's supplements, nutritional supplements, or even as Kaya Mata as an aphrodisiac, they should be regulated the same way that medications are regulated, and the same way that herbal formulations are regulated and not just available to all in every quantity according to whoever has actually the financial power to buy it. Like I say, I think if a young girl could grow up into being a young woman with the right knowledge about her own body and with her body parts intact, she would be less of a willing victim to those sort of practices. I think Kaya Matter needs to be brought under, and I hope this is a safe space because I know it's going to create a big stink in Nigeria, but Kaya Matter needs to be brought under the oversight and regulation of NAFDAC. That's my take on it.
All right, thank you so much, Your Excellency. You've really given us more than enough insight about FGM and how we can all work together to, to end this evil act in Nigeria. So we're going to move. Sincere apologies, guys. We can't take more questions for Excellency, but if you have any further question, you can send us an email at gallupnigeria@gmail.com. We're going to send your questions to her and she'll be willing to respond to every question. So I would hand over to Tony Adepoju, who is going to connect us with the panelists for this evening. Tony Adepoju, over to you. Thank you again, Your Excellency. We really appreciate you. Thank you.
All right, can you hear me?
Yes.
Can you hear me now?
Yes, yes.
All right, good evening, everyone. It's been a wonderful evening, I must say. A big thank you to Excellency for that keynote address. Well, my name is Oluwa Tony Adepoju. I'm the Executive Advisor for Gallup Nigeria. On this part of the webinar, we will be taking a look at collective strategies to end female genital mutilation in Nigeria. What do we all need to do? Now, to join me to do this, I have three wonderful women on my list this evening. I have Kende Anna Kayode. She is the project manager, Gallup Nigeria. Kende, you're welcome. Also, I have Adi. She is the director of administration and finance with Foundation. Chiamaka, you're welcome. I hope I got that correct. Multi Danjima, the communication lead. Okay, communication lead, Youth Hub Africa. You're welcome to this part of the program. Right, now let's just because we have 20 minutes to do this. Let me direct this question to, I know Youth Hub actually had a challenge this year, early this year, that has to do with FGM. Now I want to ask, how would you rate the current response to FGM in Nigeria? Like our Excellency mentioned, she said there has been increased awareness lately. Now, how would you rate the current response to FGM in Nigeria? Are we doing some things right? And are there some things we can actually do better? From your experience, and let's take the current, your recent challenge as an example.
Okay, thank you very much. First, I'll start with responses, basically, with regards to the activity Youth Hub Africa has carried out over the span of 2 to 3 years, of course, with the help of other civil society organizations that work around issues concerning female genital mutilation. So we focused on particularly states that have high prevalence and communities
that have high prevalence of that practice female genital mutilation. These locations included Ebonyi, Oyo State. Funny enough, I know quite a number of people would even be surprised, but some little communities in the FCT, the Kuje area council, areas around Kuje, Lugbe, you have where they call semi-rural areas, and semi-rural areas, basically, they still they were practicing female genital mutilation low-key. So with regards to the responses, there was a lot of awareness, and we had to put in place strategies to go about this awareness. We had to engage women, we had to engage, particularly in Oyo State, market women in partnership with a civil society organization, One Life Initiative. We also had to work with young men, a particular network called the Young Men Network, who are doing remarkable work, one of them as well. So there's been a lot of awareness and all. Now the responsiveness to it. In Oyo State, I think 2 to 3 years ago, there were some shocking responses where people were bringing up, of course, we are in Nigeria, people were bringing up religious backings. I mean, I'll call it religious misconceptions with regards to the practice of female genital mutilation. Some also said there were some form of there were cultural backings to it too. So of course we know, like I'm sure we've heard of some ridiculous explanations that female genital mutilation sort of reduces promiscuity of women and of young girls before they get married. So it's a way of keeping them for their husbands. And all these responses and feedbacks was what we got. There's also there's, of course, with awareness, it's a one-way thing. If you expect that you pass across information and you don't get feedback at the same time, so it's always good that even when you're pushing out awareness, you want to get the feedback.
No, Multi.
Whether you re-strategize the feedbacks. Hello, can you hear me? Can you hear me?
Yes, go ahead.
So these were the feedbacks we got. Also, yes, so some other in Oyo State too, they had this community of, they call the Association of I can't remember the name now. So it's an association that were in charge of cutting of female genital mutilation. So it was more or less like their custom or a kind of tradition that when a female child is being birthed, there's a period of time that they need to cut these children. So it was a lot of advocacy. So I would just quickly go ahead to tell you the strategies we used. We had to use the community-led approach as well. That is getting in touch with religious leaders and getting in touch with traditional heads too. That was what we had to do in Ebonyi. We had to speak with them, and then we had to because of course we know in Nigeria these are opinion leaders that are taken seriously. I mean, the religious heads and traditional heads, these are people that are listened to. So we had to speak with traditional leaders and religious leaders, traditional leaders. Now we respect to communities in the FCT, traditional leaders in Ebonyi, so as to educate their people and educate people who listen to them. Of course, their community, the people in their communities, as regards the dangers of female genital mutilation, because quite a number of people just thought that, okay, aside that, there's really no medical implication regarding female genital mutilation. So we had to put it in form of drawings and in form of pictorial representation of the dangers of female genital mutilation to pass across our message. Also, we had to go through policy making too. So we all know about the violence. One more. I know it's on female genital mutilation too. So we had to start engaging policy makers and start asking if these policies have been enacted, not have been domesticated in these locations.
Thank you so much for that, of Africa. Now let me ask you, what do you think we need to do better? What do you think could be done better?
I think first of all, what we need to do better is engage, because we realize, particularly in Kuje location, we realize that most of these things you don't even get to know about the FGM, because they do it in their communities low key, they do it in their families low key, it's a family tradition. So of course they will not tell you openly, you that embark, they are going to health practitioners. We had to bring together, so it was like a breakout session where we had to educate these professionals in their fields, because we had testimonies of teachers saying that, okay, in the they have students, well, and so from their end they can do a lot. We're having to report these cases of female genital mutilation even before it happens to the girl child. Also religious leaders, yes, I know in that sensitization workshop we also had religious leaders and community leaders. So we had to pass across, and it would also involve maybe communicating to them in a language other than English, just to communicate how detrimental mutilation is. And so we had to speak to these religious and local heads to tell them that such situations should not go on, or such practice should not go on in their communities. So I think that is one major way to go about it. It is one thing for policy makers to for the adoption of the Violence Against Persons Prohibition Act, and also policies that relate to discouraging the practice of female genital mutilation. But it is another thing to also engage people in the grassroots communities, because it can happen without you, an outsider, even knowing.
Thank you so much. Now let me quickly move to Chiamaka from Wave Foundation. Now, Chiamaka, I want to ask you, in your own opinion, what is that greatest challenge that you see as an hindrance to the elimination of female genital mutilation in Nigeria? That greatest challenge?
Okay, hello everyone. In my opinion, just one word: tradition. It's an uphill task fighting against tradition, because to them, you're telling them that their ancestors have been doing this for so long, like meant them harm, or didn't have their best interests at heart, or didn't know what they were doing. And we know that in our society, we hold our ancestors in the highest regard. So trying to tell them that you have been doing this for so long, yes, but this is actually, it's a bad idea in a nutshell. It's a very bad idea. That is, of course, when we at Wave Foundation, we carry our sensitization to communities, we try to envelope our message in the most polite of terms. We try to relate to them. We try to tell them, okay, we understand why you're doing this, but this is the right way. But of course, sometimes there's always this breach in communication. So animosity festers and all of that, but we try our best anyway to, temper the flames. And to add to that, we have this medicalized FGM. That is that is like a strong contender for the tradition, this thing. So when you tell traditional people that FGM is wrong, but they go to their hospital and the doctor or the medical personnel there, part of your birth package. You know, you pay this amount of money and we include FGM for you. They take that, okay, this person knows better. You understand? And when you come and tell them FGM is a human rights abuse, but the doctor said that, you know, but the nurse was the one who performed it. I went to the hospital and they told me that. You understand? So tradition it's one of is the most is the greatest single hindrance, in my opinion, to elimination of FGM in Nigeria. Yeah.
Now, I know that earlier on, Multi mentioned that has to do with awareness in Abuja and in some parts of the country. Now, do you think carrying community leaders along, making them denounce this practice, do you think it goes a long way in the elimination of female genital mutilation in Nigeria?
Yes, it's a very important factor that in all our campaigns, we try to carry the community along. A very good example is during the lockdown last year, COVID-19 pandemic, we went to some community in Buari, in Gwagwalada, you know, and we were part of the team that took palliatives to them. So that is like, and through that, through the sharing of the palliatives, we pass our messical languages, you know, depicting the horrors and the trauma and the bad effects of FGM. So we carry them along with the present circumstances, but we also pass our message to them while we do that.
Well, thank you so much, Kende from from Girl Up Nigeria. Kende, I want to ask you, how can young people be actively involved in the elimination of female? Things young people can do? Kende, are you there?
Thank you very much. You know, one thing that makes me very happy with my generation is the number of changes we're making. It's that the purpose or the goal is not to ensure decline in the prevalence of female genital mutilation in Nigeria, but to rather eliminate it totally. And this is not only in Nigeria, in Africa and globally. And I really, really appreciate the energy that young in whatever facet of life, and you can tell even from Girl Up Nigeria with the president Balkis, with all executive team member. You know, we are young persons and we're trying to make changes, and that is why I am so very, very much happy that I belong to this generation of positive. And one major way I see young persons actually making this change and genital mutilation in Nigeria is by belonging to groups and organizations such as Girl Up Nigeria, such as, you know, every group, either non-governmental organizations, religious institutions, what have you, that aims to actually, you know, contribute to humanity, that aims to make changes, that aims to create wrong, to make rights wrongs, you know. And aside that, I see young persons actually using information and communications technology to actually need to go to the root causes of that problem. And you know, for female genital mutilation, it's about the cultural norms, basically. You know, that's the major. You know, you cannot even tell when this practice started, because you can lay an emphasis to one particular period in time. We just saw it emerge, and yeah, and it's what we're dealing with. And thankfully for numbers of organizations out there that are keeping up the awareness creation on the evils of female genital mutilation to mortality. So I see young persons actually engaging with the information and communication technology to passing across information about the negative consequences. These are the kind of approaches I'm looking at in dealing with eliminating female genital mutilation in Nigeria. And, you know, basically, young persons need to take the front to the front burner to actually see to the elimination of genital mutilation in Nigeria. Thank you.
So it seems we lost Toyin Adepoju. Okay, let me see if she's back. Toyin, please unmute. Okay, good.
All right, I'm back.
Yeah.
Network. All right, is Kendi back, please?
Yeah, I'm here. I'm very much here.
Okay, sorry. My neck was a bit funny. Anyway, okay, let me quickly ask this. Now, we have to deal with the pandemic. Now, how has the pandemic affected the response to female genital mutilation in Nigeria?
Thank you very much. You know, the pandemic was an unprecedented scene. It just came bloom to us, and it's something we just have to face. It's a reality. We cannot run away from it. So the best option for us is to look for ways to actually mitigate the consequences of COVID-19. And you would admit that everyone actually felt the impact in little way or in minor way. We all felt the impact of COVID-19 from all aspects. You know, particularly when we talk about eliminating the female genital mutilation in Nigeria or even globally. You know, if it is actually envisaged that, data according to the UNICEF noted that 4 million girls and women are at risk of undergoing female genital mutilation every year. And, you know, even with the COVID pandemic now, it is envisaged that 2 million additional cases of female genital mutilation is likely to occur in the next decade. Now, it's like we are winning the case against female genital mutilation, declining the prevalence. But then with COVID-19, it's upsurging. And this is, you know, related to the disruption in programs that are aimed to protect girls from being victims of this abuse. You know, you can rightly, remember that the first panelist made mention of some disruptions they noted, you know, in the execution of that project with addressing the female genital mutilation. You know, that is the case we are seeing. You know, many events, many activities have been pending now because of the prevalence of COVID-19. And one also important fact that we should also try to, try to solve, even with the COVID, is deviating our attention from sensitive issues of gender inequality. You know, issues of gender inequality they've actually existed from time immemorial until now, and we're still trying to figure out how to find solutions to them. And with COVID-19, I'm seeing disruption of attention. People's attention are taken away from major issues, you know, to just COVID-19. And COVID-19 is not everything about human existence, so everything. You know, when we have gender equality, we have, you know, we envisage a better life. We envisage a win-win approach for everyone. So with COVID-19, we see distraction of attention from the mitigating or trying to decline or totally eliminate the practice of female genital mutilation in Nigeria. And another issue COVID-19 is putting forth is deviation of funds, like those funds that were supposed to be meant for, you know, other social problems, you know, like we have the social and health problems like this female genital mutilation present to us. They're being deviated. I want to say, you know, so these are issues we need to look into, and we shouldn't be taken in a way. We shouldn't be left unconscious to the fact that these issues are still rampant in our society, and we should not allow the prevalence of COVID-19 to take our attention from, you know, female genital mutilation. Thank you.
Well, let me say thank you so much, Kende. In other words, no time for global inaction. This is the time to unite, fund and act to end female genital mutilation. My panelists, it's been a wonderful session with you, ladies. Thank you very much. And I just want to add, let's continue to talk. Let's continue to raise awareness. I must say, gone up a lot of activities going on by advocates and activists in secondary school, start educating our girls, not only when they're teenagers. I think we should start early. And I would not say it's actually a bad idea to continue social media campaigns. Yes, I think this is also very, very important. Thank you so much for having me on this part of the webinar. I really had a swell time. Over to you, Balkis.
Thank you so much, Madam. I really appreciate that insightful conversation. Not to delay us further, because I can see that Her Excellency is still with us, and that is like, whoo, and Natima also here. Thank you so much for staying tuned, and every one of you who have been a part of this session since we started before. So I would hand over to Truth for the games. We have shirts, about 20 shirts to give out, courtesy of UNFPA and Youth of Africa. So guys, let's get to it. I want to win a lot of shirts, but Truth will not allow me to answer questions. All right, over to you.
Thank you, Balkis. That was a wonderful session. I thoroughly enjoyed every part of this conversation, and I'm hoping that just like I would, everyone here took something home today. Like Her Excellency said, it's important for us to approach this issue with evidence, and to approach it with an evidence-based approach. So our game, or this segment, is going to be about statements, myths and facts about FGM. So I'll be calling out about 6 statements, and then in comment section very quickly, you just tell me if it is true or false. At the end, the person with the highest correct answers stands a better chance. But since we are not so many, most of us might get t-shirts. Courtesy of Youth of Africa. I want to say thank you to to Youth of Africa and Way Foundation for their support during the planning and this project. So very quickly, the first one I have here is, only girls who undergo FGM can enter womanhood and be considered respectable. So is that false or is that true? I'll read it again. Only girls who undergo FGM can enter womanhood and be considered respectable. So I have some responses already. False, false, false. So yes, it is false. Cultural norms are changing, and alternative rites of passage into womanhood do not involve FGM. It does not have to. So the second one I have here is, if FGM is performed by a healthcare professional, there's no risk of harm. Is that false or true? If FGM is performed by a healthcare professional, there is no risk of harm.
Truth. I think we should identify the first winner. the first person that typed first, so the person would know that she's fine. Because a lot of people, even Her Excellency typed first, but she didn't come first. So I think the first person here is Chiamaka Nnamdi.
Yes, so Chiamaka Nnamdi are recognized. And then for the second one, I think we also have Chiam. But yeah, let's just enjoy the game. So for the third one, I'm noting the people that respond first. For the third one, so we've answered of the third one, FGM can negatively affect a relationship. Can it negatively affect a relationship? We're talking about sexual relations, we're talking about romantic relations. Can FGM negatively affect a relationship? Oh, so we have Chiamaka is really contesting for this. But we have Dr. and she's sent in the first correct response to that question. Okay, I'm supposed to say whether it's true. Okay, it's true. Many women with FGM reports, the report show that it affects their sexual relationship. It has a negative impact on their sexual and romantic relationships. The next statement is FGM can cause pain during sexual intercourse for both women and. Is this true or false? Everybody, if I was to give it to you first, thank you everyone for being so active and playing along with me. The next statement says, so yes, that is true. Most severe forms of FGM can result in pain during sexual later in life for both the women and their partners. Even women with less severe forms of experience, severe forms of FGM experience pain due to scars and lack of arousal, basically. So yes, it affects sexual intercourse negatively. So next we have men do not support the abandonment of FGM. Is this true or false? Men do not support the abandonment of FGM. Yes, that is false. I think Her Excellency got this one correct first, so that's a round of applause. Even on this topic, a lot of men are supportive of a lot of men are supportive. A lot of men want FGM to end, and we can see from data that men are against FGM. So I think we're coming. Okay, this is the second to the last question. So this question, or this statement rather, it says FGM can improve fertility. True or false? FGM can improve fertility. True or false? So yes, Jennifer, it is false, and everybody else that answered false. There's no evidence that FGM improves fertility. In fact, complications of FGM can negatively impact fertility. So we have the last statement, and this will decide. This will decide who gets my t-shirt. FGM is a religious obligation. True or false? FGM is a religious obligation. True, or is this false? Let me see you answer this question correctly first. Chiamaka, if I don't give you the t-shirt, they'll say, it can't be possible, I have to give you. So yes, FGM is not supported in any of the major religious texts. You don't find in any of the major religious texts. And religious leaders have also come out to speak against this tradition. All of this is according to WHO. So thank you very much for playing along. Please just type in your name and your location so that we can note it and we'll ship your t-shirts to you. Thank you very much. Over to you, Balikis.
Thank you so much, everyone, thank you so much, Ruth, for that wonderful session. And thank you so much, everyone, for joining us today to commemorate FGM 2021. My name is Balki Salaudin, and I'm very glad to host everyone. So please, I would like everyone to put their email address and their name on the comment section so that we can get your shirt to you. And if you're in Abuja, I can bring your shirt personally delivered to you next week when I'm coming. So I also know that Her Excellency won a shirt. So we'll be expecting the address of delivery so that we can send Her Excellency our own shirt. So thank you so much, everyone. Special appreciation to WAVE Foundation, Youth of Africa, 1111 12 Foundation for giving us their free Zoom to use. We had to use their Zoom, and everybody, Her Excellency, the entire team of Wellbeing Foundation Africa for joining, and every member of Girl Up Nigeria and our friends for joining today's celebration. I hope that next time when we gather for FGM, we would be talking sustainability and how our actions that we're going to be taking from now has impacted communities across Nigeria. So I would like everyone to turn on their camera so we can take some pictures. Though I've been taking some pictures, and if you check our Instagram story, you see yourself. But then I would like us to take pictures. So please on your camera so that we can have some pictures. Thank you. I'll be the only one that will not show in this picture because I have to take the picture. Okay, Olayemi, we are waiting. Karen, Dr. Otun, Truth, Aisha Balogun, Adiola, Karen, Chinazo, Adiola, Aisha Balogun, Truth. You have seen a lot of truths. Okay, so guys, are we good? Okay, thank you so much, everyone. I've taken the pictures, and we're going to get it to everybody. Thank you for being part of this discussion. I really appreciate you on behalf of the entire team of Girl Up Nigeria. Thank you. Thank you, Your Excellency. We look forward to more partnership with Wellbeing Foundation as we grow in Nigeria.
Well done to you. You know, I'm encouraged now that there's an army of young women who are going to take this battle forward, so I can start being a grandma.
Yeah. Yes.
Thank you very much.
Bye.
Thank you. Bye, everyone. And I don't want to leave.
And they don't leave, oh. Just stay here. Keep the house warm.
I don't want to leave. It's good to see you.